As the cost of living crisis worsens, questions are emerging about how economic hardship is affecting nutrition and public health. Although food prices have dropped slightly in recent weeks, many families say they still cannot afford a healthy meal. Trust TV's Abdulazeez Ibrahim report from Kano on the growing malnutrition crisis.
Experts say malnutrition is not just about the absence of food, but a crisis that has two faces, namely undernutrition on one hand and overweight or obesity on the other. Both forms are becoming increasingly visible across Nigeria, according to nutritionist Awal Musa.
What we call the 1 or 2 forms of diet. They can eat rice and macaroni. They eat rice and beans, maybe with oil and pepper, and drink water. This is not a healthy diet. When you go to the other people that has higher income level, they also usually eat highly proteinous food. They can finish one chicken in a day and 1/4 of ram in a day. They eat only one portion of which is what we call proteinous and fat.
For 55-year-old Abdulazeez Muhammad, despite the slight drop in food prices, feeding his family of 8 remains a daily struggle. Even when the price goes down, the money does not have much value. 1,000 naira these days cannot go very far, so we just buy what we can afford, not actually what we need. Across the country, the human face of inadequate nutrition is visible. Experts link the problem in many areas to insecurity, displacement, poor dietary habits, low education levels, and above all, economic instability.
As a clinician, the problem is more with the women, the men. Because it's easier for a man to agree that his wife breastfeeds his child very well. It's economically beneficial to him, it's convenient for him, and then a lot of deep-rooted cultural beliefs in our grandmothers tend to kind of say, we are in this hot, the weather is very hot, the breast is good for the baby, blah, 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 all sorts of things. So targeting the mothers who are who born the child, and then also carrying the breast milk will go a long way in addressing sleep than men. Of course, men need to know to support their mothers, their wives, with nutritious food and the time and energy to be able to breastfeed their children very well. So men can play a role, but the major target is women.
At Isiaq Karabiu Pediatric Hospital, staff say they treat an average of 50 cases of child malnutrition every week. Patients are brought in from urban and rural communities across Kano and neighboring states. Her body started swelling, and even her belly that we couldn't carry her on the back for the past 6 months. He used to eat different kinds of food, but now he can't eat anything except the special pap they give him here. To reverse this trend, experts are calling for stronger nutrition education campaigns for parents and caregivers, as well as training for farmers on how agricultural practices affect nutrition outcomes.
Healthy diet is not something that they require a huge amount of money. You have to know what should I diversify my diet to get all the essential requirement that my body or your body required or needed.
In the midst of economic challenges, hunger may be visible, but malnutrition runs deeper. Although programs like school feeding schemes and food aid interventions exist, experts say implementation often falls short. They are urging government and stakeholders to increase funding for nutrition programs and improve treatment access for malnourished children. Abdulazeez Ibrahim, Trust TV News, Kano.
Now, in a related development, worsening economic hardship and persistent insecurity have deepened the hunger and malnutrition crisis in Katsina State, northwest Nigeria. Experts link the rising cases of child malnutrition and preventable deaths to economic deprivation and years of banditry that have crippled livelihoods across local communities. Trust TV's Abdullahi Ahmadi has more.
Records from Medicine Sans Frontiers, MSF, also known as Doctors Without Borders, reveal that Katsina is among the states worst hit by hunger, with over 600 malnourished children reported dead in just 6 months. Across the state, thousands of people especially vulnerable households and displaced families, go to bed hungry every day, many without shelter or access to basic health care. It has also become a common sight in Katsina City and other major towns to see people, including women and children, loitering around motor parks, filling stations, and public spaces, begging for food to survive. The recent surge in food prices, driven by inflation, has further strained already struggling households, making nutritious meals increasingly unaffordable. This meal is what you depend on for the whole day. Breakfast, lunch, and dinner. We queue here every day to collect it. Otherwise, we go hungry. What we collect here is what we eat, and it has been like this for years. A philanthropist feeds over 10,000 households daily. We thank God for the gesture. As you can see, both women and children come here to collect food. It's the last resort for many of us. Most of us are displaced from our communities. If you miss this food, you go home disappointed. This is just one of many centers across Katsina where meals are shared to vulnerable families. Many of us were once well off, but lost everything to banditry. Children remain the most affected, many facing preventable death caused by severe malnutrition. In response to the growing crisis, the Katsina State government says it has set up a special committee to investigate and address the problem, particularly in the most affected communities. According to findings from the committee, about 50% of the state's population is now at risk of falling into a vulnerable nutritional status. The committee recommends both short and long-term measures to tackle malnutrition, including increased funding for food and nutrition emergencies, early diagnosis and treatment of malnourished children, and continuous education and awareness campaigns for parents and caregivers. Experts are calling for stronger humanitarian interventions and adequate funding to support vulnerable households and communities most affected by hunger and displacement. Abdulazeez, Trust Television News, Katsina.